extension, you're gonna have your patient lying prone. Let me see the best way. I'm gonna have you take off, if you don't mind, would you mind taking off your shirt for me? And I'll have you lay face down. You're just gonna have to turn your head whichever way is most comfortable for you. Your head down this way though, please. Thank you. And we'll do your left side. Draping your patient. Can you, okay, they can see it. Sorry. So in your book it shows your patient prone. This does seem a little awkward because you're going to have them working against gravity. But going through your rubric, remember you're going to bring them to the end range. You're going to give a end feel. You're going to estimate the end range, what the Goni is. You're going to verbalize what normal extension is. And normal shoulder extension is 70. Let me look at that real quick. Hold on, I have it.
Dr. Parker said we can do it in supine.
Oh, we can do it. I'll show you both ways just so that.
Sorry. I think it's 70.
Shoulder extension, 60. Sorry, I don't remember it off the top of my head. And you will have to. So it's 60 degrees. Your fulcrum is going to be your lateral acromion. Your stabilizing arm is midline of the thorax, and your moving arm is the lateral epicondyle. And in this case, if I had a high-low table, I would actually be raising it up. Thinking about body mechanics, I don't want to have to squat down as much as possible, but this table does not move. So use your high-low tables today. Please save your back, especially just for longevity of career in general. So normal expected is 70, depending on your patient's sports history, injury history. It obviously can be different from that. You'd want to compare bilaterally. So if I'm testing my patient's left side, which side would actually be affected?
The right side.
So I want to test the unaffected side first to get their baseline. Excuse me for the cold hands again. So the table is actually going to do a lot of the stabilizing, but still you want to make sure that they're not laterally rotating, they're not abducting the arm, they're not doing some like kind of crazy internal rotation. So hand on the shoulder just to start palpating to see if you're feeling any of those weird movements. Remember, reminding your patient to breathe, checking in with them, taking them to end range. Remember, this is different from MLT, so going as far as you can until you start feeling any pain or compensation, any pain or anything.
No.
You sure?
Yeah.
Nope. Nope. So that's a firm end feel. To me, that looks like it's about 50 degrees. Relax. Relax. So can you actually move over to your right? There you go. That way you can relax your arm. So preset your Goni. This is why I would use a high-low table so that I didn't have to get down on the ground to do this. But again, sorry my hands are so cold. Are you okay?
Feels good.
Oh, good. Any pain?
No.
So again, acromion is your fulcrum. Midline of the thorax is your stabilizing arm. Lateral epicondyle is your moving arm. So palpating those bony structures. And I'm actually getting 46 degrees.
So stationary arm is parallel to the table.
Perpendicular to the thorax. Yes. You're going to say perpendicular to the thorax because maybe they have some crazy bony structure.
Cool.
Questions?
So I noticed you were flexing her elbow. So would that affect the measurement if, for example, you just like kept the whole arm straight? Like if you grabbed it from the wrist and extended her arm?
Yes, you could get more if you're completely extended. Here, you could get some more biceps resistance because it's the 2+ joint muscle. I'm just having her kind of not fully flexed, but more of just kind of a relaxed position.
Okay. So you're not trying to keep it like fully extended across the 2 joints?
Questions about that? Okay. The way I think is actually easier is having them supine. Like I said, in your book it shows your patient prone, so that's why we're showing you that. Can you flip face up for me, please?
Yep.
And then with this one, I would have my patient move over to the side so that you can get their arm off the side and free. Can you move your hips towards your left shoulder? There you go, so that your body's supported. But same thing, you're gonna keep that hand on the shoulder to make sure that you're not getting any kind of superior tilting of the scapula or any weird compensations. Doing okay there? Palpating to make sure you're stabilizing and not getting any weird compensations there. Any pain? Little bit of overpressure to make sure I'm at that end range. Firm end feel. Again, same thing. It looks like it's about 50 degrees. Go back. Same procedures. Questions about that?
I couldn't see, but was the elbow bent or straight?
Still just slightly bent. I don't know if you can see.
Does it matter if the elbow is then completely flexed or extended?
So if you keep it fully straight, you could be getting biceps resistance because it's a 2-joint muscle that crosses that elbow.
Right. Okay.
So I keep it just slightly flexed, still supporting that arm, just so that I'm not running into that biceps muscle
Right.
tension.
Okay.
But you don't have to keep it like up here, just slightly in a comfortable position. Other questions about that?
Would you mind doing the Goni in that position?
So here, say your fulcrum, axis, all that's all the exact same. So it's still going to be lateral acromion for your fulcrum. Stabilizing arm is still going to be parallel to the thorax of the body. Moving arm is still going to be lateral epicondyle. So I don't know if you guys can see this. Relax. There you go. So reminding your patients to relax and breathe. Still palpating those same bony structures. Getting down at eye level that you're trying to read. And again, it's still that, what did I say, 46 degrees or something? Is that good?
Yeah, thank you.
Okay. While I have you here, face up, I'm gonna have you scoot back over towards the middle. And we're also gonna do the MLT for Pec Minor. So I'm gonna do the same right side. Let me see if I can get this over. Oh, I don't know if it's gonna help or not. So this one, you're probably gonna, because you need to look at both sides, when you're draping, just making sure that like collarbone area up is exposed so you can see both sides. And I'm gonna have you lift up real quick so I can get your hair out of the way. Thank you. So does anyone remember what we talked about on Wednesday? What is the first thing I'm gonna do if I'm doing a Pec Minor MLT?
You're gonna look at the acromion process on both sides.
On both sides. So that's why I want both sides exposed so that I can see the acromion process. And then you're gonna palpate that acromion. You want that posterior aspect of the acromion, and that's the part you're gonna measure in centimeters. And again, on your Goni, you have the centimeter side and the inches side. So you're gonna measure the centimeter side, or if you have a tape measure, the tape measure works too. It's whichever tool you have with a centimeter measurement to use. So again, in that, picking the appropriate measuring tool, either the tape measure or this is fine. So getting down on that level, palpating that posterior aspect of the acromion, so you can even use your thumbs to kind of help, once you palpate those structures, using your thumbs to kind of help give you a visual. Let's say I'm treating that right side again. I would measure the unaffected side first, or I'm going to say I'm actually treating the left side, so I'm going to measure the right side first so that you can see it on the camera. Measuring the unaffected side first, so you get that patient's baseline, and then looking at the affected side. So from that posterior aspect of the acromion, I'm going to measure to the table, and she's at 5 centimeters from the table. Is everyone clear on that? So then, now that I have that, what muscles are attaching to the coracoid process?
Brachialis, forehead.
Yes. So this is an MLT for the Pec Minor, but do I know, let's say this is 5 centimeters from the table and the unaffected side the affected side is 7 centimeters from the table. It's higher off the table, meaning something is shortened, but do I know what is shortened at that point yet?
No.
Okay, so what would be the next thing I would do? Do you remember what we talked about? Speak up. What, say that again?
Would you do all the opposite of what the actions are?
So we're talking about, because there's more than one structure that attaches to that coracoid process, we need to take out the other muscles. So it would be the next thing, somebody's doing it. I need to flex the elbow. So I'm gonna use my free hand. I wanna palpate that spine of the scapula, posterior aspect of the scapula, that posterior acromion, to see if I start to feel it moving at all when I go to bend the elbow. And it's just a slight bend. You don't need to bring them all the way up. You're just slightly starting to bend that elbow. So if I bend it, what muscle am I testing? So if I bend it and I feel that scapula move down, then I would take another measurement. And I could say it could possibly be, but you still need to do all three parts to see what muscle or muscles are involved. So but I don't feel anything. It's not moving at all. So I'm saying, okay, it's not the short head of the biceps. What would be the next thing I would do? I can't hear you guys speak up. I would flex the shoulder. Again, hand underneath the elbow, palpating that posterior aspect of the scapula because you want to feel if there's any change in movement. And again, this is just a slight shoulder flexion. Why don't I want to bring them all the way up? Because then you're going to move the scapula no matter what. Because 2/3 of your shoulder movement comes from the glenohumeral joint, 1/3 comes from the scapula. So if you start moving it all the way up, you're going to get scapular movement no matter what. So palpating on that scapula, just a slight flexion, I don't know, maybe 20 or 30 degrees. I don't have an exact number, but just enough to elicit some change if there's a muscle tightness there. And if I feel a change there, what muscle would that be? Coracobrachialis. So there's a few parts to that. Questions about that? So let's say I am here, I feel a change. I would have her hold her arm here because she's positioned, nothing else is going to change at that point. So at that point, I'd say, can you please hold your arm there? Then I would come back here, palpate that posterior aspect of the acromion, take my measurements. Now it's 2 centimeters instead of 3 or whatever it was. Questions about that? So since the Pec Minor MLT is complicated, let's just start with those two for right now. Doing your shoulder extension Goni, Pec Minor MLT. Is that okay? Questions before I let you go? Okay.